Most preppers get it wrong. You spend $10,000 on rifles, plate carriers, and night vision. You stock enough ammunition to fight a small war. You have tourniquets, chest seals, and Israeli bandages ready to plug any hole a bullet might make. You prepare for the loud, violent end. But you never prepare for the quiet threats. The ones that don't announce themselves with gunfire, but with a dull, persistent ache. You prepare for the enemy at the gates, but you have no defense for the enemy already inside your wire. A single, untreated cavity. In a world with no rules, no doctors, no antibiotics. That small problem isn't a nuisance, it's a death sentence. And it's a killer that all the firepower in the world cannot stop. The air in the bunker is cool and sterile. It smells of gun oil and sealed MREs. Marcus racks the charging handle on his AR-15, the sound sharp against the concrete. He squints through the optic, nods, satisfied. This is his fortress. Shelves stacked high with rations, water purifiers, comms gear, and enough firepower to repel a platoon. He's ready. Then, a faint throb from his lower jaw. He pauses. His tongue probes the molar. It's a familiar annoyance, nothing more. He snorts. A little toothache, he mutters, setting the rifle on its rack. In a world of bullets and bandits, that's the least of my worries. This is his first mistake. The fatal one. It's born from a psychological blind spot that plagues the unprepared. Normalcy bias. It's that cognitive shortcut whispering that everything's going to be fine, because it's always been fine before. It's the voice that dismisses the hurricane warning, because the last 5 storms veered off course. For Marcus, it's the voice that tells him his extensive training for violent conflict has made him invincible. He believes the only real threats are outside his walls. He is catastrophically wrong. The kill shot has already been fired. Not from an enemy rifle, but from the microscopic bacteria colonizing his own tooth. The mission is simple. A 5-mile reconnaissance loop to check the perimeter and scout for activity. 3 months after the grid went dark, routine is survival. Marcus shoulders his pack, the weight comforting. Rifle slung across his chest, mag seated tight. He's in his element. But the toothache isn't a faint throb anymore. It's a low, rhythmic drumbeat against his jaw. Every step on the gravel path sends a shockwave of pain up his skull. He tries to ignore it, scanning the tree line for movement, but the pain is a constant, annoying distraction. He misses the flicker of a deer in the brush he'd normally spot instantly. His focus is compromised. By midday, the drumbeat is a sharp, stabbing pain. It's an active presence, a hostile entity inside his head. He stops, leaning against a tree, and digs into a pouch on his belt. He pulls out a bottle of ibuprofen. His med kit is a temple to trauma care tourniquets for catastrophic bleeds, decompression needles for collapsed lungs, QuikClot for deep wounds. For a toothache, all he has is the same stuff you'd find in any suburban medicine cabinet. He dry swallows 4 pills. The relief when it comes 20 minutes later is a joke. It barely dulls the edges, leaving the deep, nauseating ache untouched. It's like throwing a bucket of water on a house fire. He finishes the patrol, but his efficiency is shot. His head is a fog of pain. His senses are dull. The world outside the screaming agony in his face seems distant. This is the second stage of failure. Initial dismissal has given way to a compromised state. In a survival scenario, a lack of focus isn't a handicap. It's a fatal vulnerability. A distracted operator is a dead operator. Back in the bunker that evening, the pain is a roaring inferno. He can't eat. The pressure from chewing sends what feels like an electric shock through his skull. Sleep is impossible. The throbbing is a relentless torturer. He's starting to understand. This isn't just pain. This is a system failure. Here's the tactical breakdown. The problem starts with common bacteria, mainly Streptococcus mutans, that live in everyone's mouth. When hygiene slips, these bacteria metabolize sugars and ferment carbs, producing acid. When the pH in your mouth drops below 5.5, That acid eats through tooth enamel. That's your cavity. For Marcus, this breach has allowed bacteria to invade the soft tissue inside the tooth, the pulp. His body is flooding the area to fight the invaders, creating a pressurized pocket of pus. A dental abscess. Day 3. Marcus's face is swollen, hot to the touch. A low-grade fever has set in, leaving him shivering in a cold sweat. The pain has colonized the entire left side of his head. He now understands it's on par with a serious combat injury. His mission for the day was to zero 2 new rifles, a task requiring precision and a clear mind. He has neither. He stumbles to his workbench, vision swimming. The simple act of shouldering the rifle is agonizing. The pressure on his cheekbone sends a fresh wave of blinding pain through his skull. His hands tremble. He can't hold the weapon steady, can't focus. Panic, cold and sharp, cuts through the fever. For the first time, he feels truly vulnerable. His arsenal, his armor, his fortress, all of it, meaningless. He is being defeated from the inside out. Desperate, he tears into his main medical cache. Pelican cases filled with meticulously organized supplies, IFAKs, chest seals, nasopharyngeal airways, burn dressings, traction splints. He has everything needed to stop a man from bleeding out on a battlefield. He's prepared for every imaginable form of violent trauma. As he frantically searches, a horrifying realization hits him. In all his planning, he has nothing for this. No dental kit, no extraction tools, no clove oil. He has no antibiotics capable of fighting this specific raging infection. He spent years preparing to be a combat operator, but completely ignored basic human biology. Military studies have shown for decades that dental emergencies are a significant factor in degrading combat effectiveness. In some modern conflicts, dental issues accounted for as many as 1 in 5 of all medical evacuations. He planned for the 1% chance of a firefight, but ignored the near certainty of a biological failure. He slumps against the wall. A king in a castle, laid low by a peasant uprising in his own jaw. The infection, once contained in the tooth, is now escaping into the surrounding bone and soft tissue. If it enters his bloodstream, it can trigger sepsis, the body's life-threatening overreaction to an infection that leads to tissue damage, organ failure, and death. The abscess is no longer a localized problem. It's about to go systemic. By day 5, Marcus is no longer a prepper. He's a patient. His sickbed is the cold concrete floor of his own tomb. The infection has progressed into Ludwig's angina, a severe, rapidly spreading infection on the floor of the mouth. His neck is swollen, hard as a rock. His breathing is labored as the inflammation constricts his airway. He's delirious, lost in a soup of pain and fever. In a brief moment of lucidity, his eyes land on the rifle rack. He sees the tools of power he once worshipped. He believed they were the keys to survival. He cleaned them, zeroed them, stockpiled ammo for them. He saw them as extensions of his will. He slowly raises a trembling hand to his grotesque, swollen jaw. The flesh is hot, the pressure inside unbearable. He looks at his rifle, a multi-$1,000 instrument of force, utterly useless against a bacterial enemy measured in microns. He had a weapon that could hit a target at 500 yards, but no defense against an enemy already inside the command center. This is how the prepared die. Not in a glorious last stand, but on their back in the dark, gasping for air, poisoned by their own body. He dies because he suffered a catastrophic failure of imagination. He dies because of normalcy bias, the belief that a minor problem would stay minor. He dies because he mistook the tools of security for security itself. The kill shot wasn't a .308 round. It was a gram-positive bacterium. The dental death sentence is being carried out. It didn't have to be this way. His fate was sealed not by the cavity, but by his failure to prepare for it. What if he'd traded one magazine for a $10 bottle of clove oil? Spent $50 on a basic dental kit instead of another case of ammo? His story would be one of discomfort, not a fatal tragedy. He failed to understand a fundamental rule. You must first defend against the most likely threats, not just the most dramatic. In any long-term grid-down scenario, a dental infection isn't a possibility, it's an inevitability. Before we get into the solution that would have saved Marcus, do a hard assessment of your own medical loadout. Be honest. Is it all trauma gear with no dental supplies? You're making the same mistake. If this is a wake-up call, pay attention. What you're about to learn is more critical to your long-term survival than any piece of gear you own. The foundation of surviving this threat is a three-tiered approach: prevention, intervention, and last resort. Marcus had a plan for none of them. Tier 1. Prevention, the defensive line. The best way to defeat a dental abscess is to never let it form. In a world without dentists, your oral hygiene is as critical as your operational security. 90% of the battle is won here. Your daily prevention SOP is non-negotiable. Brush at least twice a day. If you're out of toothpaste, a paste of baking soda and salt is a highly effective substitute. Floss once a day. It's not a luxury, it's a critical task. You also need strict dietary discipline. Sugar and simple starches are the enemy's fuel. Limit them. Finally, perform weekly self-inspections with a dental mirror and a flashlight. Look for chalky white spots, cracks, or chips. Your 1-year prevention stockpile for one person. At least 4 toothbrushes, 6 tubes of toothpaste, or a large container of baking soda and salt. 6 packs of dental floss and a dental mirror. This whole loadout costs less than a single box of premium ammo. Tier 2. Intervention. Active countermeasures. Even with perfect prevention, problems can happen. This is where a basic intervention kit stops a small problem from becoming a fatal one. The single most important item here is clove oil. Clove oil contains eugenol, a powerful natural anesthetic and antibacterial agent. It numbs the pain and fights the infection. Dilute it with a carrier like olive or coconut oil, saturate a cotton pellet, and place it against the affected tooth. You also need temporary filling material, often made from zinc oxide. If a filling falls out or a cavity forms, you can pack this material into the hole to seal it off from bacteria. Your intervention kit must contain a large bottle of pure clove oil, a carrier oil, a temporary filling kit, and cotton pellets. These items allow you to fight back. Tier 3, the last resort, field extraction. This is the grim reality. If prevention and intervention have failed, and a tooth is severely abscessed and threatening your life, extraction may be your only option. Historically, in austere environments, it was the only solution. This is not to be taken lightly. It's for when the only alternative is sepsis and death. You need the right tools and the book Where There Is No Dentist. It is the essential field manual for this hardware. A field extraction is a brutal, high-risk procedure. The goal is to stop a systemic infection, not to save the tooth. First, you assess. Confirm the tooth is the source of the life-threatening infection. You need a sterile field. Boiled water, clean hands, gloves if you have them. Second, you loosen the tooth with a dental elevator. This tool is inserted between the tooth and bone to gently rock it and sever the ligament holding it in place. This is not brute force. It's slow, steady pressure. Third, you extract. Using forceps like a number 150 for upper teeth or a number 23 for lower molars, grip the tooth as far down the root as possible. Apply slow, firm, controlled force, continuing the rocking and rotating motion until the tooth comes free. Finally, you manage the aftermath. The empty socket must be packed with sterile gauze. A few drops of clove oil can help disinfect the area and manage the intense pain that follows. Your last resort kit must include quality stainless steel extraction forceps. Number 150 and number 23 are a start, dental elevators, a dental probe, sterile gauze, and surgical gloves. Owning these tools without knowing how to use them is useless. Study. Understand the immense risks. Marcus built a fortress to protect himself from the world, but he neglected to defend the territory of his own body. He understood kinetic threats, bullets and blades, but was defenseless against a biological one. His story is a cautionary tale. An infected tooth in a post-grid world is not a minor issue. It's a distraction that will get you killed. It's a source of pain that will incapacitate you. And it is a bacterial time bomb that can lead to a slow, agonizing death. Take a hard look at your preps. Look past the rifles and the armor. Have you prepared for the quiet threats? Have you invested in the simple, cheap tools that will defend you from the inside out? You can have all the guns in the world, but they won't save you from a war you can't see, against an enemy you can't shoot. What is the single most overlooked item in your own medical kit? Post it in the comments. Your answer might save another operator from making a fatal mistake.